Dear Nadim Zahawi, as you are the UK COVID-19 Vaccine Strategy Minister,
and also publicly on record for saying our vaccines are safe,
I would like you to explain why you continue to promote the vaccines to the UK public.
And there is now increasing strong evidence
to support an immediate halt to the vaccine programme.
Due to the high number of reports of deaths and injuries
reported to the MHRA Yellow Card Scheme up to 2nd of June 2021.
Historically and globally.
When a number of deaths are reported to be potentially related to a vaccine rollout.
Such as fewer than 20 deaths, for example.
The vaccines are quickly withdrawn for further analysis and safety testing.
However, despite the latest MHRA Yellow Card Scheme data available, you continue to push the vaccines.
I find this frightening.
The latest MHRA Yellow Card Scheme data reveal over 1,200 deaths have been reported,
along with over 850,000 adverse drug reactions,
including blindness and other long-term injuries.
This is an incredible number and impossible to be simply coincidental.
No. Even if the numbers were half.
I would have thought any government would halt the programme
and investigate further.
Thus, I am stunned you are still pushing this vaccination onto the population, knowing this data.
Indeed, only today I read Greece and Italy have halted AstraZeneca's vaccination of under 60s because of reported deaths.
I have also discovered that the current vaccines, at least Pfizer,
are still undergoing clinical trials and have only emergency use.
Pfizer states it is currently undergoing a clinical study of these vaccines,
which run until 2023.
And there is no long-term safety testing data available.
How could there be?
The vaccines were only made last year.
And the testing, as reported in the media, only lasted a few months.
And did not represent a proper population distribution, for example, pregnant women.
Therefore, it appears that our population is being used as a testing ground for this new mRNA technology, which is used in these vaccines.
Or rather better called gene therapy, as is their foundation.
There are indeed increasing numbers of eminent, respected scientists.
Example, Dr. Robert Malone, inventor of mRNA technology and Salk Institute,
who report that these mRNA vaccines are now being found to be potentially very deadly.
It's been reported, for example, that the spike protein generated by the cell,
as a result of the mRNA vaccine,
are detaching from the cell walls into the bloodstream and ending up anywhere in the body.
These scientists thus fear this is what is possibly causing the high number of reported cases of blood clots, heart attacks, blindness, and all manner of severe reactions.
Again, all of the above must provide sufficient evidence for you to call an immediate halt to the vaccine rollout.
At least to determine what is going on. There are too many reports for this all to be coincidental.
We are in summertime now, historically the safest time where few corona cold viruses abound.
The variant of viruses always get weaker, not more virulent. This is well known amongst virologists and epidemiologists.
Thus, this would now be a best time to stop the rollout of the vaccination and conduct serious safety testing and analysis.
I do understand that there is a risk/reward benefit ratio between allowing the virus to rip, as so eloquently put in the media, through our country and injury from vaccination.
However, the numbers reported to the MHRA Yellow Card Scheme are very concerning and should force an immediate reaction.
Vaccine rollout to the children of our country.
I also wish to get your response to the recently proposed
a now determined vaccination plan of our children.
I understand that the risk of death from COVID-19 amongst those aged 20 and under
without pre-existing serious illness is below 1 in 500,000.
According to the latest MHRA Yellow Card Scheme data, the risk of death from these vaccines amongst this age group is currently standing at
around 1 in 21,300.
If the MHRA Yellow Card Scheme death reports are indeed vaccine related,
the government would potentially be causing more deaths from the vaccination of children than that of COVID-19.
I would also just like to add the data from Sweden, which is now very well known and publicised.
This Swedish data shows irrevocably that children are at almost no risk of death from COVID-19.
Sweden had no lockdown, and out of the population of 2 million children there were no deaths. This must prove beyond doubt children are at almost no risk, and thus there is no reason to vaccinate them.
The vaccines are known not to prevent viral transmissions, so any arguments to vaccinate them to stop spread falls flat.
Why mass vaccination? Or is it planned to be a form of governmental or intergovernmental control?
I would also like to seek your reply to the following troubling question.
You are on record for stating numerous times that you do not plan a vaccine passport.
Although I believe this is still under consideration by the government, listening to other reports.
And as evidenced by the push for vaccinating everyone on the planet, as quoted by well-known politicians and public figures globally.
If, as stated by the vaccine manufacturers, the vaccines do not prevent transmission of COVID-19 or its variants.
Why must the focus be on vaccinating everybody, including the healthy, whose immune system is far more capable of dealing with this virus?
If those at most risk are vaccinated already, then that is sufficient.
Global data shows that this virus is not as bad as originally feared, and most people without any pre-existing illness will cope well.
Data shows conclusively our immune systems are capable of coping long-term with this virus,
as has been done over millennia with all other virus outbreaks.
Any logic for mass vaccination just doesn't make sense unless you aim to bring in vaccination as a form of government control, i.e. passports.
Based on the information provided herein and publicly available, it would be prudent to stop the vaccine rollout immediately and conduct safety analysis.
If the vaccine rollout is not immediately stopped,
surely this must be the highest order of medical negligence in our nation's history.
Never before has such a high number of potential vaccine-related deaths been reported during a vaccine rollout in the world, without the vaccine programme being halted.
I would thus call on you to stop the vaccine rollout immediately to investigate what is happening as a responsible step.
That any sensible government or medical body should do following the data we have coming in.
We all look forward to your replies to our concerns and questions.